Don't mean to interrupt your football. Figured we would start the live stream like we do every year. Just wanted to kind of go over some plans for health insurance for Pennie and Get Covered and a few different other places. So I got my hometown of Quakertown real quick. We had some issues with the tools, but they are working now. The blast went out Friday morning, and the tool was only showing Independence Blue Cross, which is what most people have, except for when there's only one carrier showing, then the subsidies aren't accurate, as we've seen in years past. This is usually the lowest income that we'll do like a 40-year-old single making 21,000. We're planning year 2025. So if anyone's taking the time to look around a bit, you could see that Blue Cross is definitely not the lowest silver, gold, or bronze plan. Just looking at bronze. So the leader in the bronze plan category, this is the five counties of Philadelphia. That would be Bucks, Montgomery, Chester, Philadelphia, and Delaware counties. So looking at the full bronze picture, and better is the cheapest. In the silver category, and better is the cheapest. And in the gold category, and better is the cheapest. So when it comes to PPOs, it's really just a two-horse race. Independence, Blue Cross, and Highmark. Highmark's been very competitive. So this is the second year that Highmark is in the five counties of Philly. Prior to that, they serviced the entire state of Pennsylvania, Delaware, West Virginia, and parts of New York, but they did not service the five counties of Philadelphia. Last year was their first year into that. So this is their second year. They haven't brought anything skinny network wise, so it's a little hard to compete with an HMO plan. But if you're looking for a PPO, their plans are very good, especially in the gold sector here. This plan was pretty popular amongst people looking for PPOs and did not have network issues, to my understanding, at least that I saw. I think we put a whole lot of people in there because, again, this is very much an HMO market from an affordability standard. This plan is very solid, looks good too. $20 specialist visits kind of unheard of these days. So yeah, that's definitely attractive for someone who's looking to spend money for something better. So the leader's been the Silver Proactive series of Independence Blue Cross. So at this lowest income mark, it's actually 20,800, but same amount here, 364 is what the credit is available for that person and that at that income. So with Blue Cross, just all of their plans here, kind of Keystone, right? So in years past, this might have been zero. It's 36 now at this income. So it's definitely gone up some. Is it manageable still? As far as steps down from here, we could look at the bronze. The bronze HMO is a very solid plan, has a lot of co-pays in it. So let's just kind of just start being unsubjective here. So why do we default to Blue Cross? We default to Blue Cross because there's no network problems with Blue Cross. Everybody takes it. I honestly don't think you could be a doctor in this area and not work with Independence Blue Cross. That's just my opinion. But it seems to be kind of an accurate statement. So just looking at the different carriers get kind of interesting here when they throw around the deductible. So a bronze plan with no deductible, right? Sounds kind of too good to be true because it is. Usually there's a lot of co-insurance involved. So if we just look at three leading bronze plans, we do a plan compare, side by side compare. So here's Ambetter, Jefferson, Keystone, all zeroed out at this income. Deductibles, out of pocket max. This is always your most important number. We say this every year. Can't reiterate it enough. This is your stop loss. This is the most you could spend in a bad year. So your primary care doctor's 50 on Ambetter. It's 95 on Jefferson. It's 75, 115, 150, 150. Very competitive in terms of that. Prescription drug deductible. Blue Cross has none. Emergency room is a copay, and is percentage. So when you see percentages here, if you have a plan that has a no deductible, though this looks like this has gotten more competitive, typically no deductible, and then would have a lot of co-insurance. Here, if you had 8,500, after you pay 8,500, you pay 50% of the bill till you reach this maximum here of 9,200. These plans seem kind of suspect here for some reason. We're going to go just to make sure because we've had some issues with the feeds. Okay. So what I did there is enrolled.pennie.com and you can just use that quote tool before you log in, or if you don't want to mess with your application quite yet, you just want to see what's available. That's a great tool to see, just to use. Let me just get the plans by monthly premium. So again, it comes down to network look a lot cheaper than some of the others. You don't see it here on the bronze, but network is key. Jefferson Health works at Jefferson Health Providers, some other places too, like Doylestown and Grandview. But general rule of thumb is it wants to be, you want to look for doctors in that Jefferson Health system, Jefferson, Abington, Lansdale, Aria, now Lehigh Valley. So that's the biggest news of the off season here. The time between open enrollment, us agents call off seasons. The biggest news is that there was a merger between Jefferson and Lehigh, adding 32 hospitals essentially to that network. So it's just giving you more options there. And we can take a look at Lehigh Valley too in a little bit. But so Jefferson works very good at Jefferson Providers and better, kind of very similar to this network, a little bit more. They include University of Penn in their network too. They don't include Temple, Mainline Health. Neither one's going to include that. So Mainline Health is really just Blue Cross and Highmark for that. Just making sure that keeping Health Triple honest there. Okay. No, they definitely did improve their plan a bit in that sense. 0% after deductible. Yeah, let's go back and look at that zero. Let's compare the elite. So Jefferson paid attention to the market last year. One thing we didn't like was for people that don't get a lot of assistance based on income, the blood test copay was like $300 on the silver plan. That was really ridiculous. But they heard us. They took that back. So it's a much more manageable copay now for those that don't have the lowest income getting the full assistance. So just looking at this again, the health trip is wrong in that aspect. There is no ER copay after the deductible. So you have your deductible included in the deductible, separate 3,800. So for your meds, which usually doesn't include your generics. For those who aren't hip to insurance lingo, which is a good portion of everyone, if it lists a straight copay, that means you get it before the deductible. If it says after the deductible, any other terminology other than copay, then assume that you have to meet the deductible first before you get that copay or that percentage. So again, in this case, where there's a zero deductible and an out-of-pocket max of 9,200, it's a $60 lab test. X-rays is 50% co-insurance. So even though you have no deductible, you're paying 50% till you reach this 9,200 max. So keep that in mind. Outpatient facility, 50%. Yeah. Emergency room. Okay, there is a copay for that. So it is a $2,500 copay. So they're definitely listening to the market here. 3,000 per stay. I mean per day. Without that deductible, probably in the end works out to be about the same, really. But it's nice in this market. Philadelphia 5-county people really like to see those straight copays as opposed to the co-insurance that can kind of scare some people. Just seeing that straight percentage, the unknown. Pregnancy, children's dental and vision is included for all kids under 19. I can go the whole state, but let's just get an idea. Let's do a family this time. So it's $100,000 income, family of four in their 40s, getting about 900 a month. This is up in Lehigh Valley. So you can see Jefferson's up there. So Jefferson in the Lehigh Valley is going to work with Lehigh providers. It's not going to work with St. Luke's. That's always been a bit of a challenge. Capital PPOs are the only plans that work at both systems. That's why I've sold a lot of them over the years because you don't have network problems. But again, affordability is not always easy for everyone. If you're not getting the full cost sharing reduction based on income or any at all, silver usually doesn't make sense, at least outside the 5 counties, because a lot of it has to do going back to, again, silver plans have to get better based on income. And that used to be paid by the government. And then when the administration changed a few years ago, started getting paid by the insurance company. And hence the insurance companies, what they did was they made silver plan's more expensive than gold. So really, you were only looking at silver if you had a real low income and you just couldn't ignore the benefits. And, cost wise, it made sense. So up this area and actually most of the country, really, the five counties is a little bit of an anomaly. Um, it is gold plans cheaper than silver in a good portion of the country. Look at gold. We can see the prices of gold versus the prices of silver, and then bronze. So I might look for this family. Maybe the kids, maybe the family's kind of worried about the kids getting hurt. Oh, because up this way, they did realize that not having access to St. Luke's might be an issue, especially when you're in rural areas. So the PPOs do exist outside of the five counties. That's the new counties of Lehigh and Northampton will have this PPO option. So if we just look at gold plans in the PPO category, Capital's definitely very competitive there. So general rule of thumb, Ambetter has always worked good for Lehigh providers, not St. Luke's. Capital's worked at both. Geisinger is hit or miss. That really is kind of a system that works best at the Geisinger facilities. Highmark is usually pretty good, but you have to watch these My Direct plans. These My Direct plans here tend to be, when in doubt, check your doctor. When it comes to checking doctors, I'd rather you go to the website. This is the one that's in Phillipsburg, though. Yeah, so looking at Allentown, it's definitely Lehigh driven. So really, the only things that work at St. Luke's are the plans that don't say My Direct Valley, such as My Blue Access. This would work at St. Luke's. Want to stay away from the My Valley ones unless you're okay with a confined network. So again, got to pay attention to those networks, right? And Capital too. So the Capital PPOs don't have issues. The EPOs, maybe they got rid of them. They used to have their EPO. So they've just gone to a PPO model. They used to have an EPO that was cheaper, but had the same type of network issues. So Jefferson's definitely appealing in the gold category for an entire family of four making the income that we put in. It's definitely something to consider. So not an easy decision this year, that's for sure. And plus the definition of a goal plan. I mean, seeing this type of a deductible here, this does not seem like a goal plan, but that tends to be par for the course these days. You can definitely sort by deductible. These are your no deductibles. Just keep it at that qualifying income. Again, I don't really like those tools. If you're going to look at doctors, and you can see this looks the same because it's the same back end. So Aetna's still in the mix, competitive. Omnia's right there. So Omnia, Horizon Omnia, their flagship Omnia product, just the tier one and tier two. So not, most of the hospitals are in it, but tier two is a lot more than tier one. But this in recent years kind of got expensive. It looks like they've come back and become more competitive. Same with AmeriHealth there. So that's a bit of a bidding war. The Silver 2 has always been a good plan. So it comes down the network again. And the network's been pretty good actually in New Jersey. I wish they'd come back to Pennsylvania. So that has a little bit of a deductible on the horizon. 5, 10, $10 percentage, 20. So this has always been like their value plan, a lot of co-insurance in it. Their regular Omnia. Yeah. So this is someone making 20,000. So they've really kind of priced, this out. The advantage is the better network. We'll look at that price cost, and that's someone who's making 20,000 now. Going over to Delaware. So we're looking at that same 40-year-old with that lower income. So Ambetter's gotten very competitive there. Highmark doesn't have those network issues in Delaware. Highmark doesn't offer anything but PPO. Because with most Blue Cross plans, if it's a PPO, you do get National Blue Access. Means you can go to any Blue Cross, Blue Shield PPO doctor in the country and you should be in network. horizon. So going back to our friends in Jersey again, real quick. So nothing has changed in that sense. This has always been the problem in Jersey since Affordable Care Act plans have kind of come out, at least other than the beginning. There's nothing that lets you leave the state of New Jersey unless it's an emergency. So Aetna will let you go to a minute clinic because they're owned by CVS. So you could go to any CVS in the country and see a doctor there, which is nice if you're traveling. But if you're a snowbird, you live half the year in Florida, none of these plans are going to work for you. The only thing that's going to come close, and they're not even all over the place in New Jersey, not in all the counties, is WellCare, which is Ambetter. They do let you go to any doctor in the country that's Ambetter. Now that can be hit or miss, as we were just going over in terms of the health systems. But if you live in Jersey, you want to see Penn doctors or Jefferson doctors, that would be a fit for you because Ambetter is accepted at those facilities or used to be. Again, just always check. Um, yeah, but United Healthcare, even though they kind of came back into the mix again, they don't let you leave Jersey, Oscar, none of these other plans that you leave the state of Jersey at all. So keep that in mind. So it's nice. PPOs are very hard to find outside of the Philadelphia area. There's not a lot of places in this country that have PPOs. It's amazing. Um, for individual plans, group company plans are different, Medicare plans are different. We're talking just about under 65 people through the marketplace or looking for that guaranteed Affordable Care Act compliant plan that takes you regardless of health issues, no pre-existing conditions, that all that goodness, 10 essential health benefits that the Affordable Care Act says that plans had to adhere to. Those plans do get kind of limited based on the network. Delaware is a state where you're going to see that the bronze, the silver, the gold is cheaper than the silver. At least with Highmark, I bet. Yeah, so the silver is 101. That's someone with the lowest income. You can see the gold nudges that out. So yeah, they're definitely getting a run for their money in all categories. So here's the silver with Ambetter, 2000 deductible. These are the premiums. Oh, sorry, out of pocket max 2000. AmeriHealth Caritas. So this is not AmeriHealth in New Jersey. It's all the same parent company. Independence Blue Cross, AmeriHealth Caritas, and AmeriHealth in New Jersey. They're all the same parent company, but AmeriHealth Caritas Next is in a couple different states. AmeriHealth New Jersey is just New Jersey, so just a different branch of the company. So this is the lowest income, 2000 out of pocket maxes are on par, $10 here. Lots of co-insurance again. No co-insurance with Highmark. Emergency room, $75. These other ones a percentage, which even if your income is low, what this tells me is that one trip to the emergency room could have me guaranteed to hit this, where at $75, I would have to have an awful lot of visits to come anywhere close to this 1200 per hospital stay. So there's per stay and there's per day, and that's prevalent in the Medicare world too, right? Per stay means no matter how many days you're in there for one admittance. So if I'm in there for a week and didn't leave, it's $175 for the whole stay versus when they're per days where you're get paying per day. Or here where it's just a straight percentage. I don't know. I have a lot of clients in Texas too, especially San Angelo. I have a group of clients that they're watching. Yeah, looks like United Healthcare has expanded into the rural areas of Texas a bit more. So Ambetter's come on strong. Not too bad, but if you're on a fixed income, it's definitely something to consider, but just, tread with caution in terms of doctors. So the Blue Cross of Texas still looks good on the zero. I mean on the gold. So the gold is still cheaper. Um, there's someone making this income though. You can see why they're pricing it out because this income articles on our blog about that. Do it for me insurance. So why would you not do the gold? That sounds like that would be better, right? Again, you didn't see any PPOs there. Higher at a higher income, this would be much more. So that's drawn down in this out-of-pocket max versus this. So you got to do what makes sense for your budget. But if you have a lot of high utilization, even if you're only paying nothing, if you're using the plan a lot and you're getting close to this, I mean, those are things that affect. There's more to cost than just monthly cost if you use the benefits a lot. Yeah, same kind of mechanism here. So, I mean, when I say mechanism, I'm talking about the software company. So get insured, started with Nevada, went to PA and Jersey, expanded to Virginia, and is now Georgia Access, which had some issues last year. So the state of Georgia wanted to do a state-based exchange. So again, you either have a state-based exchange or you have healthcare.gov. You do not have both. Here in Pennsylvania and also New Jersey, we used to be with healthcare.gov from the beginning and then switched over in 2021 to a state-based exchange. A lot of states have started state-based and have gone to healthcare.gov, but it's usually them coming from healthcare.gov to state-based exchange thinking they're going to save money because there's fees and taxes and such involved with using the government site. So there's a trade-off there. Work with Care First in Virginia, Cigna, Innovative Health, which is Aetna. Also work with Kaiser. Don't have Optum. Oscar's not really been great and working on getting Santara, who is believe again is a health system type of thing where it's like the doctor and the health insurance company like Jefferson, they're trying to do it all. So that's another one I believe, if I'm not mistaken, but Innovative Health, which is Aetna. So I'd like to just always kind of go to silver. You can see same exact back end. You can see these subsidy numbers, they vary by zip code and state. So in Georgia, we have access to Aetna, Ambetter, Anthem Blue Cross, CareSource, Cigna. Do not have Kaiser there, but Kaiser tends to be somewhere that works at a specific system too. And United. So all these in Georgia. So Georgia's a great market. I'm not sure offhand, but it always used to be Florida was number one in terms of enrollment um, in the under 65 space for the marketplaces. Texas is always two, one and two there. Georgia's like they're usually always a good market. So, and actually the fun thing is Health Sherpa, even though they show other states, they have never been able, to my knowledge, that I've ever seen to enroll someone in a state-based exchange. But Georgia is the first that is allowing for that. So you can bypass healthcare.gov altogether and use this for healthcare.gov states and for Georgia. So we got our bot friend here. Takes you to our resource page that we built last year. So we're going to be adding Georgia here. It's been a very tricky year. We haven't done our Medicare one yet. We usually do our yearly Medicare. We haven't done that yet because Medicare still has not announced the Part B premium, and it's hard to put a presentation together with speculative numbers. So once the numbers are available, Part B based on incomes, Part B deductible, IRMA is called based on your income, you could pay more for Part B. We're going to do our whole big Medicare one with our usual presentation once those numbers come out. But for now, you can still consult with our 2024 one until those numbers come out. Well, it is speculated that it's going to go from 174 up to $185. But again, it's not formally announced. There's been years that they haven't increased, like COVID. So although it's most likely they are with all the changes to Medicare, with the Inflation Reduction Act capping that $2,000 max on drugs, prescription drugs. Who knows until maybe they're just waiting until after the election. Not really sure, but that Part B number is not out yet. So again, this is just kind of this is some resources and it defaults to my phone number contact page. So there's that. So yep, and then we have a whole slew of resources here. Really been trying to build up this blog under 65 clients and people that have asked for quotes and stuff in the past. So this is just a e-blast you may have gotten, or if you want to get it, you can send me your email. I'll add you to it. But we send this out. We send it out early at the beginning, and then sometimes around the holidays as a reminder that we're getting close, and then usually right at the end. So the deadline's like December 5th, December 7th for Medicare, December 15th for most of health insurance, December 31st is New Jersey, and then January 15th for most of the country, and then January 31st for Jersey. and a couple of the other state-based exchange. Those are the enrollment deadlines for the year to buy health insurance. You cannot buy health insurance outside of the open enrollment unless you have other situations going on where if your income's in that low bracket, that 20,800 and not much more than that or less than that, you can pretty much change your plan or buy year round. Or if you lose coverage through work, you move to a new area, although sometimes moving isn't enough if you didn't have coverage before. But this is the time from now until December 15th to change your plan for January 1st. And then up till January 15th is your time to change your plan for the entire year of 2025. After that, you're locked in or locked out if you don't have insurance. And there aren't a whole lot of alternatives anymore. If you if you follow our page at all, we had talked about how beginning September 1st, short-term medical, which used to be a decent alternative to Affordable Care Act plans, they decided to regulate that again. So again, it's something that's been around forever, and then so many people were using it as a alternative to Affordable Care Act that under the Obama administration, they limited that to 3 months at a duration, but you could buy as many 3 months as you wanted. So you had companies selling you 4 3-month plans to cover a year. Under the Trump administration, it went back to the states. So here in Pennsylvania, we had 360 days, 5 days short of a year. Places like Texas and Florida, you could do 3-year plans, like where you're buying 3 1-year plans at a time, and you're actually getting preventative care after the first year. So, it was definitely something that was as close to as it could possibly get. We like to call it hit by car insurance because really it's you pay everything up to the deductible and then they cover everything up to $2 million depending on which co-insurance you selected. We usually used to like the elite plan where you would have no co-insurance. So then effective 9/1, it went back to the Biden administration said you can only have it for 3 months with a 1 month renewal, and that's it per carrier for the whole year. So there are states like Jersey where you can't have short term at all. Delaware, I don't think has any offerings because United hasn't really been offering anything there. Um, so that's not a realistic fit anymore. This newsletter goes into that more. There are indemnity plans like Freedom Life and Philadelphia American, which is basically just like an Aflac plan. So like Aflac's model has always been um, they don't want to be your health insurance company. They want to help you with a high deductible. Whereas, if you say you have a high deductible, you go to the hospital, there's a fixed benefit regardless of what it costs that it would pay you out. So Aflac's always wanted to kind of work with the health insurance plan, whereas Philadelphia American Freedom Life want you to have a beefed up version of that. What's scary about them is if it's $1,000 a day in the hospital, yes, there's network negotiation where they're going to cut the bill down in half or sometimes more depending 40 to 60%, but that's very very hard to be comfortable if you have a $900,000 open heart surgery that they're going to negotiate that bill down and give you enough that that's going to be manageable. United Healthcare excels in those, um, but and their goal is to kind of make you no worse off than you would be on an Affordable Care Act, meaning on a bad year of Affordable Care Act. If you met your out-of-pocket max, that's kind of their goal there. So we do have now Pennsylvania, we don't even have the option which you could switch companies. So once you exhaust those 3 months with a 1 month renewal for the 12 month, you cannot get any more short term because we don't have any other carriers currently. Allstate is not in Pennsylvania. I do think Pivot is, and I have them, but that's just been kind of a startup company, so I haven't really had too much experience with them. Or I don't want to shortchange them, but it's not a national brand like United Healthcare. But so here was our newsletter, which is part of our blog. But we have more than just our. For a while there, it just seemed like our blog was just our e-blasts. But we really have been striving to do more. Here's our Medicare. This is the letter. So for our Medicare clients, we actually send them a letter every year. And if you're our client and you haven't gotten a letter, we might have a bad address for you. Because when you move, a lot of times the insurance companies don't tell us that you moved, or update the address. Then we also have understanding the changes to Part D. This is how I get this a lot. So you have a family or a couple, and let's say the husband turns 65, goes on Medicare, and the price isn't much different for one than it was for two based on the amount of subsidy we're getting and the total price. So this kind of goes on, talks all about that. Then we have our dental and vision. So we keep updating these too. So this has a bunch of resources because we get lots of questions about dental and vision. So biggest problem with dental insurance is they love to hit you with waiting periods, right? That's their way of making sure you're not buying it, getting the service done and dropping it. And we talk about it in here, but there's very few that will waive it. These are the only companies that I know of that will waive a waiting period if you have 12 months of prior coverage in dental insurance. And they don't count like a discount plan, but real dental insurance. Um, well, I think actually Humana might count their basic plan. And actually Humana is going to be here in Pennsylvania selling plans on Pennie. So the plans on Pennie are pretty good. We sold a lot of the Delta ones, just the inexpensive one for 10 or $12 because it gives you cleanings and offers a discount, whereas the ones that are like 40 or $50, they're more comprehensive. And if you don't have the waiting period or so, or plans that don't have waiting period, like Delta has one for $66. Again, all this stuff is here. You can explore and read more. Um, but I found that those $12 plans are pretty good because it just covers a cleaning, gives you some of that network discounts, basically a glorified discount plan. But a lot of people have liked those and it's been pretty good. And so these are the ones I know that'll waive a waiting period. And we talk more about balanced billing, group plans, vision, with a whole bunch of resources for links and stuff. So thanks for tuning in. Go enjoy football and feel free to shoot me a note if you have any questions or want to talk about anything.